Today I'm going to explain what is a sacrocolpopexy. Let's going to discuss three important questions about pelvic organ prolapse. How common is this problem? Well, about 11% of patients by the age of 80 will have a surgery for pelvic organ prolapse or urinary incontinence. Not only that, but about 50% of female after pregnancies will present with a pelvic organ prolapse. So the answer to that question is this is a common problem. What is the definition of a pelvic organ prolapse? Well, it is defined as the descent of one or more organ confined to the pelvis. And this could be the bladder, the rectum, or the bowel. Finally, what are the symptoms that present with a pelvic organ prolapse? Well, the most common one is pelvic bulge, followed by other symptoms like pelvic pressure, pelvic pain, back pain, voiding complaints, bowel symptoms, pain during intercourse, or even difficulty in walking or sitting. Here we can see the normal anatomy of the pelvis, as highlighted by the red star. There is the bladder. Behind the bladder is the vagina with the uterus, and behind the vagina is the rectum. Here we see an anterior defect, which is the drop of the bladder into the vagina, as highlighted by the red star. Here we see an apical defect, which is the tip of the vagina lose its support and drop inside the vagina. This is a posterior defect that is characterized by the drop of the rectum inside the vagina. This is the drop of a loop of bowel inside the vagina, and we call this enterocele. And finally, this is the drop of the uterus, as highlighted by the red star, inside the vagina. So until now, we have reviewed what is a pelvic organ prolapse, which is the descent of one or more organs. Now, the question is, what is a sacrocolpopexy? Here we can see a sacrocolpopexy as highlighted by the red star, which is the mesh going from the vagina to the bone, known as a sacrum, and this will give the support by pulling up all the organs in the pelvis, and this is accomplished by placing the mesh from the vagina to the bone. In this particular picture, the hysterectomy has been done, but the cervix is preserved to facilitate the attachment of the mesh. But this surgery can be done as well in patients with previous hysterectomies or in patients that want to preserve the uterus. Now, the next question is, what is a laparoscopic sacrocolpopexy? Laparoscopic means that we have to make 4 to 5 small incisions in the abdomen that allow us to introduce surgical instruments that allow us to perform the surgery. In this case, the sacrocolpopexy. This can be done with a robot or without a robotic equipment. Either way is done using the same small incision in the abdomen. Recently, a new laparoscopic approach has been developed, which allows you to make a small incision through the umbilical scar, and through this small incision you can place 3 or 4 laparoscopic instruments that allow you to do the surgery. This is known as a laparoendoscopic single-site surgery, or as well single incision laparoscopic surgery. The idea behind is 1, 2 to 3 centimeter incision that allow you to place the laparoscopic instrument rather than 4 to 5 different incisions in the abdomen. Now, what is an open sacrocolpopexy? It means that we have to make a 7 to 10 centimeter lower abdominal incision that would allow us to get access to the abdomen and perform the surgery. This is considered the gold standard. So the next question is, what are the complications associated with sacrocolpopexy? The complications associated with this technique can be divided into early and late. Most complications can occur with any approach, but a few complications are unique to a particular procedure, such as the risk of converting to an open procedure when performing a laparoscopic sacrocolpopexy, either using the robotic equipment or not. This can go from 0% to 5%. As part as well of the early complications can be injury to pelvic structures like bladder, ureter, or bowel. This can be from 1 to 4% of the time. As well, infections, thrombotic event, meaning that you start forming clot in your lower extremities, bleeding, or as well an ileus, which is the bowel become lazy and is not working. The leg complications can be associated with bowel obstruction, can be in 1% of the time, mesh erosion about 3 to 4% of the time, and incisional hernia as high as 5% of the time. What is mesh erosion? Mesh erosion means that the mesh that you have placed to pull up the organ as a sacrocolpopexy has grown through the vagina or into the bladder or into a bowel loop. If this happened, you need a second surgery to remove the mesh and repair the organ. These happen about 3 to 4% of the time. And then the most common question that patients are asking about mesh is all these TV commercial about problems related with mesh, and if you have one, please call so and so lawyer's office. So the reason of this is based on the FDA's warning. No discussion of pelvic organ prolapse will be complete without mentioning of the October 2008 FDA press release regarding concern about the use of transvaginal mesh. Then the FDA concluded at the time that the physician should require a specialized training and should be aware of the risks and potential adverse event and should inform patients that complication may arise from the implantation of mesh. In July of 2011, the FDA issued another warning regarding mesh for prolapse repair and specifically exclude the sling that we use for urinary incontinence. And we will talk about those urinary incontinence sling in another video. But it's very important to understand that this FDA's warning is related to a transvaginal incision to place a mesh for pelvic organ prolapse. An abdominal sacrocolpopexy is an abdominal incision that we do to place a mesh on the vagina. So the FDA's warning does not apply to an abdominal sacrocolpopexy either laparoscopically or open. The last question, do I need an anti-incontinence surgery? Concomitant stress urinary incontinence surgery at the time of the pelvic organ prolapse repair should be discussed and offered to patients with preoperative evidence of stress urinary incontinence, specifically acknowledging the unique risks associated with the stress urinary incontinence surgery, and if it's not performed, the possibility of needing additional surgery for persistent or worsening the stress urinary incontinence after the pelvic organ prolapse repair. Thank you very much for your attention, and I hope that I accomplished my main goal, which was to answer the question, what is a sacrocolpopexy, and give you all the relevant information about pelvic organ prolapse. If you have further questions, please do not hesitate to send me an email. Thank you very much.